Welcome to Hyperemesis Maternity Program Antenatal class. Today, Sister Talia is chatting to us about Hyperemesis Gravidarum. Welcome, Sister Talia.
Hi, everyone. Yes, so today we'll be speaking about Hyperemesis gravidarum. It sounds very intimidating and it sounds very bad because it exactly makes women feel quite unmanageable in your pregnancy. It's severe nausea in pregnancy, basically. So we know the term morning sickness. So it's when you're vomiting in the morning occasionally. It usually can be in the morning or even sometimes morning hours or evening hours, and is discomfort. However, we give the severe diagnosis hyperemesis gravidarum for patient about 1,000 times worse than the normal morning sickness that you would incur. So it's severe nausea caused by substantial weight loss and may need hospitalization. So what are the symptoms? So with extreme nausea, this is one symptom that I always tell moms that will remain. It's not the inability to eat, because oftentimes even with normal morning sickness, you will notice you've hardly had anything for the day to eat. But it's the severe weight loss and dehydration that goes with it. It's actually moms can't even tolerate a bit of juice, water, or a bit of rooibos tea to just calm that nausea or to get something in. So it's a complete decrease in appetite. It's completely debilitating for anybody. We can think that if that mom needs to go to work still, especially early pregnancy where we're also working in full swing, if she's still, maybe it's her mom at home and needs to take care of other kids at home, it's literally so debilitating that if you lift your head up, you already feel like, you can't cope for today. So the primary distinction for me is your coping ability. You will really feel the Afrikaans word is misluk. You feel really misluk all the time. Like you feel like you can't tolerate another day feeling like this. And 5% of this happens that the pre-pregnancy weight completely falls off. And that's one of the big things that we can identify. And who is at risk? This is always one of the things we never know. Doctors cannot say who will experience it or not. You can have 3 pregnancies and 2 of them you've never experienced it, and the third one you do, or the first one you experience it and the rest never again. So oftentimes when moms have had this and they're pregnant again, they really get anxious, really anxious, and they will say, "What can I do? I don't want to feel like that again." And it's even something that can make moms severely depressed, because you can think, you're feeling nauseous every day, you're vomiting every day, for months on end. How are you going to feel? One of the most famous people that I can relate to that's had this is our own lady that's married to Prince William and the Duchess of Cambridge. So Kate Middleton has actually had this, and she's very public to say how she struggled, and I think people ridiculed her for losing so much weight. But they didn't know behind closed doors she was just being a lady, being pregnant, and trying to come over this diagnosis of being so severely sick all the time with vomiting and weight loss. So how can I prevent that? It is one of that things that it's not preventable, but I would say regular prenatal visits. So what does that mean? Going to your sister, your midwife regularly, going to your doctor regularly, and making sure you're getting your nutrients in. So remember, we're not just giving a mom a pill a day, a vitamin a day. There's other things as well as the foods you eat. It's seeing a good dietitian could be one of the steps, but prevention is not really there. However, treatment is there, okay? We must make sure mom is on the proper treatment, because we don't want effects, not just on the mom's health, but also on this growing baby's health. So how is it treated? So firstly, we need to accurately diagnose. After that, oftentimes mom may lead to hospitalization, which can be needed for a bit of drip. So we give the IV therapy, which will consist of maybe some vitamins in the bag, or just plain water that we give to just refuel the system again. We will place mom, if you're admitted, on bland foods in the hospital, and that's often what we ask moms to take at home. So often just getting the fluids up again, getting some food in the body. And then we may also be giving some IV medication that has some antiemetic, which means anti-nausea medication in. And this is with severe cases, but oftentimes this is the first time moms are so oftentimes diagnosed because they've started becoming pregnant, they've been feeling bad, been vomiting, and people have said, oh, it's morning sickness, try some ginger biscuits. And then another person would say, try some tea, try this, try that. And this lady is just losing weight. She's just getting, less energy because she's got no fuel to get this engine going every day until she becomes so sick or dehydrated that she needs to go see a doctor. Doctor can oftentimes send her directly into the hospital to be admitted and to just gain some strength for a few days on a drip. And that is oftentimes our first point as midwives and as even with the gynaes that we can diagnose a mom, because she's maybe not said anything even in our visits with her. She said, oh, I'm nauseous, but it's normal, She hasn't said actually how severe she's been having nausea, or not just nausea, the word nausea, vomiting as well. So keep in mind that we take necessary precaution to safeguard your health and that of your baby. And it's very important. If I always tell moms, even with normal morning sickness, if they tell me, oh, sister, I'm nauseous, it's normal, then I say, it's not really normal. It's one of the trials of pregnancy and one of the things, but there is treatment. Never think you have to go through anything in pregnancy alone, especially vomiting and nausea. There is medication and there is help available. So by the 20th week, many women will say that they're still experiencing it, especially this gravidarum, because it's one of those things that kind of can go on, go on. Often women can say up until their last day of being pregnant, but there is some light. Many patients I know, once they are on the proper treatment, have said it made them be able to deal with every day, because the nausea, we take away the height of the nausea. So we just lessen that. We can't take it away completely. I always say to moms that the medication to take complete nausea away is too strong for that little growing baby and fetus, and it can cause damage. That's why we can only give you certain things that is safe for you and baby, but they can't harm baby, but at the same time just take away the worst. Like it can go from here and we can just bring it a bit down for you in terms of the intensity. So I always start with medication. Asics, it's one of the antiemetic or anti-nausea medication. It's safe to use, but remember, if you have severe, doctor will prescribe something stronger many times that is still safe for baby. Okay. And then one of my favorite little tools I tell mom is mom to be pregnancy shake. I love it. Strawberry flavor for most moms. They love that flavor. I don't know if the shop sells any other flavors, because I only sell this one to all my moms, because I know it's not as strong in taste. So if you're a mom that's not really nauseous, I would say use the shake for some extra energy and boost. But for a mom that has severe nausea, morning sickness, or gravidarum, I always say get the shake in strawberry, because it's not a sweet flavor, and it's a bit more of a blender, and you can add some things. You can add some banana in the morning. That's a meal. If you can't get anything else in, you've got to add something in. You can add some peanut butter. There's so many things you can do with this shake to just make it more nutritious. And even on its own, it's already nutritious, but to add some things will make it much more filling for you as well. And that shake mentioned earlier, it's something you will take every morning, once a day. Okay, so when you are taking that shake, make sure that you take it once a day only. Remember, it has a substance of protein. We don't want too much protein, but we want that once a day, because the protein is what heals us, heals our body, heals our tissue, and keeps us going. Not just carbohydrates, like we think we need protein just as much. So what should I ask my doctor? So, sister, I've been feeling not well. I've been vomiting a lot. I think it's morning sickness, but I've lost weight. I've actually been unable to cope a lot. Even as a bit of a sign of depression with the nausea can be a big indicator. So what I always tell moms, before trying to conceive, if you had it in your previous pregnancy, and you are going to start seeing a gynae even before conception, start getting a lot of folic acid in, a lot of vitamins in to just get your body ready. Make sure that you are prepared for your next pregnancy. Physically, you are strong enough because it can occur again or it cannot. That's one thing we can't predict. Emotionally, that you have a support system, a network that can pick up your previous, your babies that you have at school. If on that day you are not able to lift your head, you're feeling too ill, a network of people that can support you by the days you're not feeling too great, and mentally that you have spoken to somebody, you've dealt with how you were feeling, because a lot of moms feel very alone going through this. And then you speak to your doctor about making sure you're healthy before becoming pregnant and that your weight is not too low. Okay, and other nutritional defects such as iron that's low, magnesium that's low, because low magnesium can also add to even more nausea in pregnancy. So those are all things we need to look at before having another pregnancy if you've experienced it before, the hyperemesis gravidarum. Then I always tell mom, please make sure that you spoke to your doctor before doing a next pregnancy. So I've just added a little example. So I often get these calls from mom and they ask me, sister, what would you say can I eat? Remember, in this diet that I'm not a nutritionist, but I am a midwife, and we do nutrition as well for our pregnant moms, for patients, for everyone. So in this diet, I've not put in, if you're lactose intolerant, if you are, then you would skip anything dairy with your equivalent. If it is milk, I'm saying, you will add your almond milk, etc. If you are vegetarian, you'll obviously skip out on the things that contains any, meat products or anything that you do not take in your diet. And even if you have certain religious reasons, you don't take certain things. But just a broad kind of things you do have at home, and things that can make it a bit more pleasant to kind of work out your day. Snack, and more snacks. That's what I always tell moms to have, especially if you have this condition, because keep it in little Tupperware buckets. You buy this little 5-in-1 Tupperware buckets, the small ones, and you pop it in your bag, 5 of them. So throughout the day, and in there you can put some crackers, you can put in some cheese, you can put in some pretzels, salty things, peanuts. And it's things you can snack on during the day that will keep you going. But this is more of a set out meal. So what do we want? We want small and frequent meals, because heavier, bigger meals is just going to sit on the stomach and cause nausea again, cause vomiting. So smaller meals and not too far apart, because if you're going to wait too far apart between your meals, your blood sugar will dip and your nausea will increase. So often you should be eating very often. And strangely enough, a lot of moms have said to me, sister, the more often I eat and snack, the better it helps. If I don't eat, I get even more nauseous, almost like the eating helps it in a way. Fluids. So water is not always the best bet. Clean water, because a lot of moms can get nauseous water as well. So I say pop a cucumber slice in your water. Keep it nice and cool. It's summer now. Take some rooibos tea, put it in the fridge, add a bit of sugar, and even a lemon slice, and keep it in the fridge, as a iced tea. Those are all things that can equivalent your fluid intake, but it doesn't make you feel like, oh, I've just drank another glass of water of 3 liters I have to drink. So that's a very good tactic to use. Gas out. Any gas cool drink will make you vomit a bit more. And then things like your Energade. On days where it's extremely hot, each mom we know has a different route to follow a day. Some moms are on the road all day and they dehydrate even quicker. Then I say, have a little Energade, 500 mils, have it in 2 days, 250 today, 250, but you're still going to have your clean water. Remember, we don't want to overdo with too much things on the kidneys as well. So fluids is a must. And then fatty foods such as fried foods, gravies, KFC chickens, all those things will just make you feel worse. Honestly, it will. It's one of those things that will really make you feel great while you're eating it. I think afterwards you'll be so nauseous because the fat keeps a layer on your stomach that it just pops in on top of your digestive system, and it actually makes the vomiting quicker to occur. So we want you to have a lot of carbs. So this is the first time in your life you can have quite a lot of carbs, and people will encourage it because it will give you some energy. So cereals, breads, we're looking at your croissants, things that is pleasant to eat, but also nice, and things you can pop in anywhere, like in your bag. You can pop it in your fridge, keep it in your fridge and take it out quickly. And avoid foods that's too spicy. You will see, if you always love curry, suddenly curry won't do anything for you, or things that's very, very high spiced, including caffeine. It may make you even more nauseous. Rooibos tea, no milk always, because the milk actually curdles and causes even more nausea. So how does my day start? We will take crackers and some slices of bread. So remember, crackers is a carb and bread. So you will choose which one, and that you will have on your empty stomach. So next to your bed, because that's where your day starts, where you have gravidarum, is next to your bed, you're already feeling, oh, I'm going to get up, I'm going to be so sick. So the first thing you grab is your crackers or a slice of bread. So the night before, you put it next to your bed. Now you're up, you've had your shower, you're getting your breakfast ready. You can have a cheese. All pasteurized, remember, not unpasteurized, because it has certain bacteria in pregnant moms. So your harder cheeses, your Gouda, your cheddar, those things. And then that with a slice of bread or cereal that you prefer, with your milk or your yogurt. So again, it's a cereal that if you like muesli, a lot of moms survive on the ones the kids love. It's the Cocoa Pops. It just keeps them going a little bit, and it's pleasant to taste. And then a little snack. Again, this is so important to have your snacks. Your rooibos tea, again with no milk, just a bit of sugar or honey for taste. And your apple, that will be your snack. And then you can add something salty if you want to, but we don't want to overdo the salt because we don't want to end up with quite a high blood pressure again. So lunch, we always say a salad deconstructed. So when I say deconstructed, do what you have at home. If you have some cucumber at home, you have some lettuce and tomato, but you don't have anything else. Or today you have papaya, and you maybe have pineapple for some reason. You slice it up, put it in, and you add it now with the meat of your choice. It can be fish, like your tuna, chicken, or you make yourself a mayonnaise and a salad with pasta again. If you don't have any salad ingredients in terms of your tomato, lettuce, and you have pasta, you can add pasta, which is our carb we want to have in, and our protein, which is either our meat, fish, or chicken, and add some mayo or some nice dressing to it, and there you've got your pasta salad. Then we're going to our snack again. You will see you eat a lot, and it doesn't actually make any of these moms pick up weight. It just is very healthy, and overall, even for moms with morning sickness, this is a very, very good diet to follow. So for lunch, you've done your lunch. Now comes your snack. So lunch will be at 12. Remember, we have 2 to 3 hours interval of your meals and snacks. We don't want you longer than that without food. So 12 o'clock, at 2 o'clock, you will have your snack, which is either banana or a mom-to-be pregnancy shake, or you can pop the banana in the pregnancy shake, or a cup of rooibos tea. So rooibos tea and a banana, or pregnancy shake and a banana, and then your dinner will happen at about 5 or 6 o'clock. Early evening, never late food for you, because the late food will make you want to vomit during the night. So dinner will be a pasta with chicken, or your basic, your meats, whether your meat be chicken, fish, or chicken, fish, or red meat. And you can add with some rice. Rice is very good because it keeps everything down. It's bland. You can even add a little bit of the Italian herbs to your rice, just to give a bit of flavor, but that won't give too much flavor, and a little bit of spice. Remember, a little bit of that. And then a potato. Potato is nice and starchy. It will keep your stomach lining nice and relaxed so that vomiting doesn't occur, but it will help you quite a lot. And then after dinner, can you believe it? So now you ate at about 5 or 6 o'clock, and now we're looking at 8 o'clock. You have to have a snack because you're going to see by 8 o'clock the nausea will creep up again. So a nice snack for me, for a mom that's pregnant at 8 o'clock the night with gravidarum, is one slice of bread with the peanut butter. Because the peanut butter will sustain you and the bread throughout the night a bit, till you wake up the morning. So already when you wake up the next day, your blood sugar is not that low because you've already had almost like your last food at 8 p.m. the night. That's just a bit of the diet. And yeah, I hope that diet really, you can, even take some screenshots of it and keep it on you, because it really helps for you to just have, people just say, eat some carbs, eat some protein, but they never actually tell you how to take it. And that's it from me. So, moms, any questions about this topic? You're free, if you are Bonita's member, to call the baby line and get some more health info. That's what we're here for, 24 hours, 7 days a week. And that is the service we render to you. So any more advice you need on this topic, or to want to know, do I have this sister? Which doctor do I see regarding this? We can discuss it, or pop some questions for us down below, if you have any questions regarding the topic as well. It was so nice speaking to you guys. And remember, this feels like a lonely journey when you have gravidarum, and a lot of moms feels really alone and isolated because not many people understand it's a nausea that takes longer than the different morning sickness nausea. But you're not alone. Know that we're always here, ready to advise you and to help you. And we are trained professionals helping you in this matter.